Reality has shown us that preparing for the future is much more complicated than we expected. Health needs and solutions change so quickly that we need methods to make decisions in an agile way. The Rare 2030 Foresight Study is a unique opportunity for the rare disease community to press the pause button in our busy lives. An opportunity to think deeply about the present and future challenges faced by people living with a rare disease, using foresight as a tool to recommend the most resilient future. Foresight provides us with different future scenarios. It sets out strategies and policy options to help us reach the scenarios that are most preferred and prepare for those that are not. The goal of the Rare 2030 project is to use these simplified scenarios to create a shared vision for an updated policy framework for rare diseases in Europe and improve the journey of living with a rare disease in 2030 and beyond. Through broad consultation, we have highlighted 10 trends that will affect rare disease policy and combine different progressions of them to come up with 4 possible scenarios for 2030. If we continue as we are, we'll end up in the fast over fair world where stakeholders collaborate, but only when they share the same interests. Due to a significant private investment in research and development for rare diseases, many breakthrough technologies are available for diseases that are well understood, but very rare and complex diseases are left behind. Patient organizations, healthcare professionals, and other stakeholders working across disease areas and multiple countries are key players. They help identify the gaps and disparities and advocate for better healthcare, treatments, and research by considering the patient experience. New IT solutions gathering large amounts of health-related data provide great potential to advance care and treatment. However, major bottlenecks exist due to a lack of clear and simple rules and incentives to share information, especially between the public and private sectors. Health remains the responsibility of each country. Driven by budget constraints, services are prioritized, and although new technologies may come quickly, access to them is slow and limited. The challenges in driving fast and fair innovation are likely to create frustration, as well as an increased distrust in science, healthcare, and the systems that govern them. If distrust in supranational efforts to manage health continues, we may find ourselves in the "it's up to you to get what you need" world, with national 2-tiered healthcare systems. In these systems, basic care is provided by the government, and a second tier of care exists for those who can pay for better quality or faster access. In this scenario, the health and social welfare systems are well integrated, and patients may get the holistic care they need, but it will highly depend on the country in which they live. Given that no country has sufficient numbers of patients to conduct adequate research, innovation is hampered in this scenario due to a lack of investment in multinational collaboration, data collection, and sharing platforms. The innovation that does reach the market for rare diseases is extremely expensive and only accessible for the richest countries and wealthiest patients, eventually making the market too small to attract investment. Following the principles of a free market economy, we might find ourselves in the "technology alone will save you" scenario. Here, the government doesn't have a leading role, and private companies are the ones managing the health of people living with rare diseases. Healthcare systems are private, insurance-based, market-led, and profit-driven. Many innovations, such as health applications, are available to people living with a rare disease, enabling them to be responsible for their own health. Patient organization support may even be largely replaced by technologies that allow patients to manage their own needs. Several private companies have created fast and accurate diagnostic options, but only for those who can pay for it. Thanks to the investments of health data companies, artificial intelligence and other cutting-edge science have led to breakthroughs for some of the most complex and rarest diseases, but many still remain without diagnostic and treatment options. Genomics has also developed dramatically and is regularly used by doctors and individuals. When commercially exploitable, the data is gathered in a collective way to find information that is helpful to patients. Patients and consumers may even be financially rewarded for their participation. If we prioritize societal responsibility, equity, and the collaborative policy frameworks to achieve them, we will end up in the investments for social justice world, where major investments have been made by governments and are fairly shared across Europe, ensuring health and well-being of all European citizens, and equity for vulnerable populations, including those living with a rare disease. The European Union's increased legislative power in areas of health and social welfare fosters access to care, treatment, education, employment, leisure, psychological support, and reduces the risk of being left behind, no matter where you live in Europe. Healthcare systems are led by an understanding of a holistic view of a patient's needs, including the curative, but also the preventative, rehabilitative, and palliative. This understanding is based on comprehensive health data collection, seamlessly shared across borders in a system also designed to integrate data from consumer and profit-driven companies. Multi-stakeholder initiatives prioritize investments in rare disease research that responds to patient needs. These efforts cover as many diseases as possible. The resulting innovations are regulated and assessed at the European level and with greater transparency, accountability, cost-effectiveness, and consideration for the patient experience. Innovations may develop slower than in other scenarios given the limitation in government funding and increased regulation. With the right public and private partnerships, the field of rare diseases could play a pioneering role in promoting such a deep, positive change in European health and social policy for all citizens. Right now, we are at a pivotal moment of decision-making. In recent decades, the rare disease community has improved diagnosis, care, and treatments for people living with a rare disease. But without constant effort, this progress can easily be reversed. Each scenario should inspire each of us to prepare the legislative, political, and financial frameworks needed at the regional, national, European, and global levels to improve the health and well-being of people living with a rare disease. Which is the most likely? Which one do you most prefer? Let's prepare the best future with the right policies and priorities to get there.